Hello. So today we'll talk about breast cancer. Breast cancer now very very common cancer when they happen for especially all over the world, but it is very common in Nigeria, especially Africa. And for women, now one of the commonest cancer when they happen to women, breast cancer are the commonest cancer when they happen to men. Though it happen to men, a lot of people don't know say breast cancer. They also happen to men. Understand? So about 99% of breast cancer they see them for women, but 1% of men they come down with breast cancer. And me personally, I don't see people men when get breast cancer. So this topic now for everybody, not just for only your wife or for your mother, but for yourself, especially if you get strong family history of breast cancer. So you always do good make you to check yourself as a man. Understand? So today, as I tell you, breast cancer is very common, and the commonest breast cancer in the world. They say out of 8 women, there's chances that one out of 8 women will develop breast cancer later in their lifetime. So it is very important for us to discuss the risk factors, those things wey fit cause breast cancer, and those things we fit do to prevent breast cancer. So one of them in our list, very very strong, one of them in our list, now family history. If your father or your mother or your siblings or your mother sisters or your father sisters don't get cancer before, or they don't get ovarian cancer before, you get high risk of having that breast cancer. Then another thing again wey go cause breast cancer na obesity. People wey dey obese have higher risk of developing breast cancer. Another thing wey go fit cause you breast cancer na smoking. Yes, smoking dey cause oral cancer, smoking dey cause lung cancer, smoking dey cause stomach cancer. Smoking can also cause you breast cancer. So those of una wey dey smoke shisha, when dey smoke weed, when dey smoke cigarette, you get high risk of having cancer, breast cancer. Then those of una wey dey take alcohol, studies don show say alcohol dey cause cancer. Then again, dem get some certain kind of food wey we dey like eat, especially for Nigeria. If you dey eat all those food wey get saturated fat, like when they contain coconut oil, our red oil, those the chicken, the skin of chicken, you dey like kilishi, you dey like suya, you dey like those red meat when they contain fat, nkwobi and co. All those things, studies don show say e dey cause cancer, especially breast cancer. Then another thing again wey dey very common when dey cause breast cancer na lack of physical activity. A lot of people no dey like do any exercise at all. No dey like skip, no dey like walk, no dey like run, no dey like swim, no dey like do cycling. Nothing. You just want from one car to another, from your car, enter your car, you go office, from office you come back home, from your car you go church, from church you come back home, from you wan go market, you go enter car, you go enter okada, no form of exercise at all. You know, we just say make you take out one day, just trek around or make you run around. So lack of physical activities, understand, dey cause breast cancer. Then for those people wey see their menstruation early, if your menses come early, especially normally most time menses dey come between that age of 12, 13, 14, 15, 16. So once you don dey pass that 16, e don dey late. So if your own come earlier before 12 years, you started seeing your menses before the age of 12, there's chances. I no wan go into detail to explain. I just wan explain, just tell you the risk, because there's a reason why that thing happens. So understand, because of prolonged insult, understand, like a kind of injury because of hormone. So I no wan go in details that, but if your menopause, your menses started very early, maybe before the age of 12, you get higher risk, especially if you get all this family history, if you get obesity, if you know they do exercise, if your diet, the kind of food you dey eat, all these factors dey involved, then your menses come early in life, there's chances that you will have breast cancer. Then for those people who never born before the age of 30, so understand, before the age of 30, if you never born, there's high risk that you could develop breast cancer. Then for women who never born at all, if you never born at all, especially when they reach 40, 50, 60, so you no born at all, you get high risk of developing cancer. Then those women when see their menopause late, some people they get early menopause around 45. So some people they see their menopause 50, 55, 65. So those people when they see their menopause very late, so they have a high risk, very, very high risk of developing breast cancer later in their life. Then they get another thing, genetics. This one na wetin you no fit control. Then they call them non-modifiable risk factor. Then get some families wey get some kind of gene, when we say that gene then they transfer them from one offspring to their children. So some of those genes are BRCA1, BRCA2. Then they get some kind of gene when we say if they get mutation, if anything happen to that gene, that gene they help to protect our body from getting cancer. They call it tumor suppressor gene. So if they get mutation for that gene, TP53, if they get mutation for that gene, your body will begin produce cancer. So if in a family get any of those mutations and they also get BRCA1, BRCA2 gene for their body, there's chances that they will pass it to the next offspring, and most of those offspring will develop that breast cancer and also maybe ovarian cancer. So these are the risk factors that if you get them, there's chances that you will get breast cancer. Though there are some factors that we can control on our own. Something like exercise. Okay, we feel control them. So move the exercise. These are ways you can prevent it. Obesity, and if you do exercise, definitely you will reduce weight. Okay, and obesity don't be implicated for a lot of problems. Obesity will cause you heart problem. Obesity will cause you arteriosclerosis. Obesity will cause you stroke. Obesity will cause you hypertension. Obesity will cause you diabetes. So now good thing sef if your weight reduce. So when you're exercising, definitely your weight will come down. Then the kind of food you eat, more stop to the eat things when they fry things. More reduce the eat red meat. Okay, more they eat more of vegetables in smaller quantities. As the more they eat vegetables, more then they eat vegetable oils in smaller quantity. Even the red oil, definitely as an African, you can't do without red oil, but in small quantity. Okay, then if you get family history, okay, if you still go marry person and get family history of breast cancer, na problem you do. Okay, so family history is very important. So who you dey marry, they're very important for the sake of your children. That's why you want to marry, ask question very well. I'm not saying you should discriminate, but not your choice. But ask question well because of the next generation. Okay, because there are certain families that you marry, once they get that gene, there's high chances that one or two of your pikin will get that breast cancer. So also smoking, stop smoking. Smoking no good. Smoking they cause so many problems. Stop alcohol. Alcohol they cause so many problems. So many problems. So with all these factors, if you feel stop them, at least those modifiable risk factors, when you feel command them, your chances of having that breast cancer could reduce significantly. So maybe next time we'll be talking about the signs and symptoms. Those things when we say if you see them, you will know say you get breast cancer, or maybe you suspect say you get breast cancer, and which you will at least go see your doctor. So thank you very much.